Hello everybody, my name is Kira Online and welcome to SurgerySquad.com. It's basically a series of games that are medically based. And some of these games, I've been playing them for a little while. They are not for the faint of heart at all, or the squeamish. Like for example, it even says here, this surgery may contain graphic procedures inappropriate for children or squeamish adults. So I am boned. Here we go. Gotta love that in North Carolina speedy internet.
Welcome to Surgery Squad's laser tattoo removal. I'm Dr. Susie and I'll be assisting you with this procedure today. According to a recent poll, over 50% of those with tattoos want at least one removed. They cited being too young when they got it, a new career, or significant life changes, such as divorce or childbirth, as reasons why they no longer want them. Luckily, there's laser tattoo removal. Laser tattoo removal is a procedure that uses a powerful laser that reacts with the ink of a tattoo to break it down into tiny particles. The laser directly targets the tattoo pigment and leaves the surrounding skin virtually untouched. After the ink is broken down, it is removed by the body's immune system, creating a natural-looking fade that typically only time or sun exposure would produce. Although laser tattoo removal is considered highly effective after multiple treatments, those interested need to keep in mind that yellow, green, and fluorescent tattoo inks are much more difficult to fade. Our patient today is a male in his mid-20s that got a tattoo on his calf when he was a teenager. Now that he's older, he doesn't see the tattoo as being so attractive anymore. In fact, he's come to us to get it removed. So let's scrub in and see what we can do for him. Before we begin, we need to go back in time to the day he picked out his tattoo. Help him pick out a real winner. Use the arrows to scroll through the tattoos. Click Choose when you have made up your mind.
Okay, speed is key.
Interesting choice. The heart's a nice touch. Let's make that tattoo disappear. During our patient's initial consultation, it was recommended that he take a non-aspirin pain medication prior to the procedure to reduce any discomfort he may experience. Other than that, there really isn't any other preparation needed. So let's get started.
Okay, let's do it.
A lot of patients describe the pain from the laser as feeling like 100 rubber bands striking the skin at the same time.
Ow.
So to begin the procedure, we'll need to place a cold compress on the tattoo for a few seconds. This will help reduce the pain caused by the laser. Go ahead and place the cold compress on the tattoo.
Okay, just
that will
press
do.
that on there.
Now we need to use the laser to fade the tattoo. Different types of lasers react with certain colors of tattoo ink. One laser might work perfectly for reds and oranges, but not so great on greens or black. So we'll use a variety of lasers to get the desired result. To help relieve some of the pain associated with the procedure, we'll also use a machine that blows icy cold air on the area being treated. Let's start by targeting any red or orange ink areas.
Okay. Oh, I can hold it down, okay. Jackie's gonna be so pissed if he ever sees this video.
Next up is green, blue, or other darker colors.
Okay. So, yeah, in the meantime, I may as well just make idle conversation. Did you guys see the new trailer for Age of Ultron? That trailer was kind of meh at best, but hey, we got to see more of the Hulkbuster, so that's a win-win for me. Okay.
Finally, we'll remove the black.
Okay, remove black, okay. Okay, so... Okay, that's gone, so let's do that.
Now that we've completed the first treatment, we'll need to place the cold compress on the treatment area to...
Okay, shut up, Susie. Shut up, nurse!
You did great! Our patient is ready to go. Immediately after each treatment, the tattoo may feel sunburned, and it is extremely important to keep it covered until it heals. If our patient fails to do this, both his recovery and the results of the treatments may be negatively affected. Roll the bandage over the treated area.
Okay then.
As stated earlier, our patient's tattoo will only begin to fade after multiple treatments, so we shouldn't expect the tattoo to go away during one session. While the tattoo may not be completely removed, it should be lighter and much less visible than before. And that's laser tattoo removal. Well done! Why not try your surgical skills in another surgery here on SurgerySquad.com?
Yeah, you know what? Yeah, that's not a bad idea. Let's do that. Okay, guys, so I figure we'd go for colonoscopy. For those who don't know, a colonoscopy is where they stick this little, like, camera hose thing up your butt and look for any bad signs, like any signs of, like, colon cancer, stuff like that. Compared to some of the other ones I saw, this seems like it's the most non-graphic, I guess. I don't know. So here we go. I'll link the website down below, and if you guys want to check out this website for yourself, go right ahead. So
Surgery School's virtual colonoscopy. I'm Dr. Jeff, and I will be guiding you through this colon today. Also known as the large intestine, the colon is responsible for the final stages of the digestion. It absorbs remaining water and electrolytes from indigestible food, accepts and stores food remains that weren't digested in the small intestine, and eliminates solid waste from the body. A colonoscopy allows your doctor to view inside your entire colon using a device called an endoscope. As the scope moves into your colon, your doctor views the output on the monitor to check for growths or polyps.
that's yummy.
There are several parts to the colon: the cecum ascending, the transverse, the descending, and the sigmoid. A colonoscopy can check each one of these areas. The one thing about having a colonoscopy is that a doctor can find polyps and remove them immediately. This is the most effective way to prevent the development of colorectal cancer. However, you'll need to cleanse your colon 24 hours before the test by taking laxatives or performing a fleet enema. Also, use of the endoscope might accidentally tear the colon walls and cause bleeding.
Ooh.
Plus, you'll need to be sedated during the exam, which should take about 30 minutes or longer if any polyps are found. We have a 53-year-old female waiting for her colonoscopy. Let's get scrubbed and take care of this. Our patient is lying on her left side, knees drawn up to her stomach. She's wearing a gown, and we have a sheet draped over her. Let's set her up with an IV drip of the sedative.
Okay. Click on the vein to sterilize the area with the alcohol wipe. Okay. Click where indicated to insert the needle into the vein. I hate needles. I'm the biggest chicken shit when it comes to needles. Like, every time I go to get blood drawn, I'm like,
Great. Now we'll wait a few minutes for the sedative to take effect.
Okay.
Our patient is sedated and ready. She stated that she's cleansed her colon, and I've already used a lubricated, gloved finger to check for blockage. Be sure to tell the patient that she should breathe slowly through her mouth to relax her stomach muscles if she feels cramping. We'll insert the endoscope into the anus and slowly move it into the colon. The endoscope contains a small camera and light, and a pair of forceps so we can remove any polyps we find. First, let's lubricate the scope for easy insertion and passage through the colon.
I gotta do the whole thing? Oh, it's that sound, man. Ugh. Have. Okay,
Carefully insert the scope into the patient's anus and slowly move it into the colon. We're into the rectum now. Nothing so far. Let's move on into the sigmoid colon. Slow and steady. You're doing a great job. The colon's next. Now's a good time to remind our patient to breathe slowly through her mouth as we do the exam.
why am I playing this again? Alright, because you guys wanted me to play it. Yeah.
Alright, let's move into the transverse colon.
Oh, let's squish it.
Uh-oh, looks like we've got a small polyp in the transverse colon. We'll use the forceps to remove it.
Okay. Click and drag, okay.
Fine work. We'll need to remove the scope so we can bring the polyp out. First, let's use some heat to cauterize the spot and try to stop that bleeding.
Okay.
Fantastic. Let's slowly withdraw our scope and get that polyp out.
What the hell is a polyp?
Let's go back in and check the rest.
Okay, while I do that... Okay, okay, Google.
Remember the name of the colon where we found the
What
polyp?
is a polyp?
That's right, the transverse colon.
Polyp, a solitary or colonial sedentary form of a coelenterate such as a sea anemone, typically having a columnar body with the mouth uppermost, surrounded by a ring of tentacles. In some species, polyps are a phase in the life cycle that alternates with a medusoid phase.
Okay, so a small growth, typically benign with a stalk protruding from a mucous membrane. Okay then, that's
Back in the transverse colon now.
interesting.
Fine, and you're doing a great job. Now's also a good time to remind our patient to breathe through her mouth slowly. Moving now into the ascending colon. And there's one. Let's take it out the same way we did the other.
Okay. Okay. Okay, grab you, and let's pull you back.
Back in the ascending colon now, and we move into the cecum.
Oh,
And all looks
fuck.
good. Let's take out the scope and get our patient into a recovery room. Our patient is in recovery, and she'll probably be there 1 to 2 hours. She might feel bloated or need to pass gas, and since we removed 2 polyps, she'll probably have a small amount of blood in her stool. We'll also do a biopsy on the polyps. She should call her doctor immediately if she has heavy rectal bleeding, lower abdominal pain, develops a fever, feels dizzy, vomits, or experiences swelling in her abdomen. Well, good news. The biopsy showed our patient's polyps were benign. Since she's in her 50s and there were polyps found, she should have a colonoscopy every year. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Okay, that's where I'm going to leave it off here, guys, for today, guys. I hope you enjoyed the video. If you did, like, comment, subscribe. This has been Dr. Kira signing off. And I will see you guys in the next video. Bye-bye!